Hello and welcome. My name is Lindsay Stevens. I am the Medical Facilities Manager for Parapharma Tech, the company that produces Gelmix and Purathick. I'm also a speech-language pathologist and have practiced for nearly 20 years. I have experience in a variety of settings, treating adults and children with feeding, swallowing, speech, language, and cognitive communication disorders. For 16 years, I had the honor of serving medically complex children at Phoenix Children's Hospital in Phoenix, Arizona, where I specialized in feeding and swallowing disorders. I'm also a mom of 2 kids who had feeding and swallowing disorders in their first few years of life, so I have firsthand experience with thickening liquids. This presentation will focus on our products and how they can be helpful for swallowing difficulties and spit up. Gelmix was developed in 2010 by pediatric gastroenterologist Dr. Enrique Hernandez in South Florida. He created Gelmix as a healthier alternative to using infant cereal to reduce infant spit up. While using infant cereals to reduce spit up has been a widely accepted practice, Dr. Hernandez recognized that cereals added bulky starch to the diet, could cause constipation, and required babies to stop consuming breast milk. Breast milk has amylases that break down the starch in the cereal, thin the liquid, and negate the purpose of thickening. Dr. Hernandez wanted a product that would not significantly alter the nutritional benefits of the liquid and that would allow children to continue on breast milk. Shortly thereafter, the healthcare community treating those with swallowing difficulties began to use Gelmix to thicken liquids. In 2018, Purathick was created for children and adults over 1 year of age. Gelmix is a powder that gels up when mixed with water. It is made of 3 simple ingredients: organic tapioca maltodextrin, organic carob bean gum, and calcium carbonate. Gelmix can be used with term infants weighing at least 6 pounds and premature infants who weigh at least 6 pounds and are a corrected age of 2 weeks, which is 42 weeks post-menstrual age. Therefore, Gelmix should not be used in infants born prematurely until they weigh a minimum of 6 pounds and are 42 weeks post-menstrual age. Gelmix is designed to thicken breast milk and formula, but can be used with any warm liquid. Gelmix is kosher certified from Kosher Organics, a kosher certifying agency recognized by the Chicago Rabbinical Council that certifies only natural and organic products. Gelmix only uses halal ingredients and is vegan. It does not contain any animal byproducts and is free of heavy metals, arsenic, GMOs, cornstarch, xanthan gum, and major allergens, including dairy, gluten, corn, and soy. Because of the simple ingredients, Gelmix maintains the nutritional composition of the liquid to which it is being added. Gelmix is also smooth, tasteless, and odorless. There have been no adverse reactions reported with Gelmix since it came on the market in the United States in 2010. There are a number of studies and literature reviews showing carob bean gum safety and effectiveness with neonates. A link to that information can be viewed on our website at www.healthierthickening.com. I'm going to go back for a moment. Common side effects may include gassiness and loose stools for the first 2 weeks of use. This is due to the naturally occurring fiber in the carob bean gum. This is most commonly seen in infants under 3 months of age and generally subsides on its own. Like Gelmix, Purathick is also made of 3 simple ingredients, including organic tapioca maltodextrin, organic Terra gum, and calcium carbonate. Purathick is also USDA Organic, kosher certified, free of animal byproducts, heavy metals, arsenic, GMOs, cornstarch, xanthan gum, and major allergens. Purathick can be safely used in adults and children over 1 year of age. Purathick can be used in hot and cold liquids, is easy to use, doesn't excessively thicken over time, and is tasteless, odorless, and smooth. The difference between Gelmix and Purathick is the main ingredient. The carob bean gum in Gelmix requires heat to activate and thicken. The Terra gum in Purathick requires agitation to thicken. The use and safety of Terragum have not been studied with infants younger than 12 months of age, which is why Gelmix is recommended for infants. Thickening liquids can be an important and helpful intervention for those with swallowing difficulties, also known as dysphagia. Dysphagia can cause portions of the food or liquid to go near to or into the airway. The images here depict a normal and abnormal swallow. We are looking at this person from the side. You can see the nose, the mouth, the throat, and the two tubes. The front tube is called the trachea, and the trachea is also known as the airway or the breathing tube. On top of the trachea is our larynx. That's where our vocal cords are. Our larynx is sometimes called our voice box as well. The tube behind the trachea is the esophagus. This is also known as the food tube. When we eat or drink, the food or liquid enters the mouth, is mixed with saliva, and then formed into a small ball called a bolus. The bolus in this picture is depicted here in green. The picture on the left shows a bolus moving normally into the esophagus. The picture on the right shows a part of the bolus going into the larynx. This is called laryngeal penetration. So the bolus is penetrating or entering the larynx. If the food or the bolus goes through the larynx, through the vocal cords, or past the level of the vocal cords and enters the trachea, this is called aspiration. The only thing that should be going into our airway is air. If saliva, mucus, food, or liquid enters the airway, the person can experience symptoms of dysphagia, which may include, but are not limited to, coughing, choking, gagging, chest congestion, wet vocal quality, wet breathing, and difficulty breathing. These can cause discomfort with feedings and respiratory illness. There are multiple research studies that validate the benefits of thickening for dysphagia. Here are a few that show how, when compared to thin liquids, thickening creates a more cohesive and denser bolus that moves more slowly through the swallow and enhances sensory input as it moves through the mouth and throat. Thickening is associated with dysphagia symptom improvement and decreased hospitalizations related to dysphagia. Thickening is also well documented for reducing spit-ups. This picture of an infant shows his esophagus and stomach. Here's the esophagus and the stomach. These two pictures are a close-up of the stomach, showing the esophagus going into the stomach. The esophagus has a sphincter or a valve at the bottom called the lower esophageal sphincter. Now, the sphincter is supposed to be closed after food has entered the stomach, and that keeps the food or liquid from coming up through the esophagus. This picture shows the food or the liquid in the stomach and the esophageal sphincter closed. This picture shows the food in the stomach and some of the food contents coming back up into the esophagus because the lower esophageal sphincter is not closed, it is open. Infants' lower esophageal sphincters are generally relaxed or open, making it easy for food to enter back up into the esophagus. Gastroesophageal reflux is the physiologic passage of gastric and contents into the esophagus. It is hypothesized that a thicker liquid reduces the likelihood of the food moving from the stomach back up into the esophagus and helps keep the food in the stomach. In 2018, the North American Society for Pediatric Gastroenterology, Hepatology, and Nutrition, also known as NASPGHAN, and the European Society for Pediatric Gastroenterology, Hepatology, and Nutrition, known as ESPGHAN, published Pediatric Gastroesophageal Reflux Clinical Practice Guidelines. These guidelines state that thickening feeds to reduce regurgitation and vomiting in infants is the preferred first-line therapy approach. The guidelines also recognize that Caribbean gum thickeners, like Gelmix, are the only thickeners suitable for thickening breast milk for infants under 1 year of age. Gelmix and Purathick are the only USDA certified thickening agents on the market. Please visit our website for more information or contact us with any questions. Thank you for watching.